Omeprazole is a widely prescribed medication used to treat a variety of gastrointestinal conditions, including acid reflux, gastroesophageal reflux disease, GERD, and peptic ulcers. As a proton pump inhibitor, PPI, omeprazole works by reducing the amount of acid produced in the stomach, providing relief for individuals experiencing persistent heartburn, regurgitation, and other uncomfortable symptoms. While omeprazole has proven to be an effective treatment for many, it is essential to understand the potential side effects associated with its use. In this comprehensive video, we will delve into the common and less common side effects of omeprazole, explore their impact on daily life, and discuss strategies to manage and minimize these effects. By the end of this journey, you'll have a deeper understanding of the complexities surrounding omeprazole and be better equipped to make informed decisions about your healthcare. Common side effects of omeprazole. One of the most prevalent side effects associated with omeprazole is gastrointestinal discomfort. Many individuals report experiencing the following symptoms: nausea and vomiting, diarrhea, constipation, abdominal pain or discomfort, flatulence. These side effects can often be attributed to the medication's mechanism of action, as the reduction in stomach acid can disrupt the normal digestive process. In some cases, these side effects may subside as the body adjusts to the medication, but for others, they may persist throughout the duration of treatment. Additionally, omeprazole has been known to cause headaches, dizziness, and fatigue in some patients. These neurological side effects can have a significant impact on daily activities and overall quality of life. Less common but serious side effects of omeprazole. While the majority of omeprazole users experience only mild to moderate side effects, there are a few less common but more serious adverse reactions that individuals should be aware of. Bone fractures. Long-term use of omeprazole has been linked to an increased risk of osteoporosis and bone fractures, particularly in the hip, wrist, and spine. Kidney problems. Omeprazole has been associated with an increased risk of acute interstitial nephritis, a condition that can lead to kidney inflammation and damage. Vitamin B12 deficiency. Prolonged use of omeprazole can result in a decrease in the absorption of vitamin B12, potentially leading to anemia and neurological complications. Increased risk of infections. The reduction in stomach acid caused by omeprazole can make individuals more susceptible to certain infections, such as Clostridium difficile, C. diff, and pneumonia. It is essential to discuss these potential side effects with your healthcare provider and to report any concerning symptoms promptly. Long-term effects of omeprazole use. While omeprazole is generally considered safe for short-term use, prolonged or long-term use can lead to more significant health concerns. Some of the long-term effects associated with omeprazole include increased risk of dementia. Several studies have suggested a link between long-term PPI use, including omeprazole, and an increased risk of developing dementia or Alzheimer's disease. Malabsorption of nutrients. Chronic use of omeprazole can impair the absorption of essential nutrients, such as calcium, magnesium, and iron, potentially leading to deficiencies and associated health problems. Increased risk of heart disease. Some research has indicated a possible connection between long-term PPI use and an elevated risk of cardiovascular events, such as heart attacks and strokes. Gut microbiome imbalance. Prolonged omeprazole use can disrupt the delicate balance of the gut microbiome, potentially contributing to the development of various gastrointestinal and immune-related disorders. It is crucial to discuss the potential long-term effects of omeprazole with your healthcare provider, especially if you have been using the medication for an extended period. Impact of omeprazole. Side effects on daily life. The side effects associated with omeprazole can have a significant impact on an individual's daily life. Gastrointestinal discomfort, such as nausea, vomiting, and diarrhea, can interfere with work, social activities, and overall quality of life. Headaches and fatigue can make it challenging to maintain a healthy and productive daily routine. In some cases, the more serious side effects, such as bone fractures or kidney problems, can lead to hospitalization, rehabilitation, and long-term health consequences, further disrupting an individual's daily life and financial well-being. It is important to recognize the potential impact of omeprazole side effects and to work closely with healthcare providers to develop strategies to manage these issues and minimize their interference with daily activities. How to manage and minimize omeprazole side effects. If you are experiencing side effects from omeprazole, there are several strategies you can employ to manage and minimize their impact. Communicate with your healthcare provider. Inform your doctor about any side effects you are experiencing, no matter how mild they may seem. They can help you determine the best course of action, which may include adjusting the dosage, switching to an alternative medication, or implementing lifestyle changes. Adjust your dosage. In some cases, reducing the omeprazole dosage or taking it with food can help alleviate certain side effects, such as gastrointestinal discomfort. Incorporate dietary changes. Adjusting your diet to include more fiber-rich foods and staying hydrated can help manage side effects like constipation and diarrhea. Engage in regular exercise. Maintaining an active lifestyle can help improve overall digestive function and alleviate some of the side effects associated with omeprazole. Explore alternative therapies. Complementary treatments, such as probiotics, herbal remedies, or acupuncture, may help manage certain side effects and support overall gastrointestinal health. Prioritize self-care. Engaging in stress-reducing activities, such as meditation, yoga, or mindfulness practices, can help mitigate the impact of omeprazole side effects on your daily life. By working closely with your healthcare provider and implementing a comprehensive approach to managing omeprazole side effects, you can take proactive steps to minimize their impact and maintain your overall well-being. Alternative medications to omeprazole. If you are unable to tolerate the side effects of omeprazole or if the medication is not effectively managing your gastrointestinal condition, there are alternative medications that may be considered. H2 receptor antagonists, H2-ROS, medications like ranitidine, famotidine, and cimetidine work by blocking the production of stomach acid, providing an alternative to omeprazole. Antacids. Over-the-counter antacid medications, such as Tums, Rolaids, or Maalox, can provide quick relief for occasional heartburn and acid reflux. Sucralfate. This medication forms a protective coating on the lining of the esophagus and stomach, helping to heal and prevent ulcers. Prokinetic agents. Medications like metoclopramide and domperidone can help improve the movement of the digestive system, potentially reducing reflux and other gastrointestinal symptoms. It is important to discuss these alternative options with your healthcare provider to determine the most appropriate course of treatment based on your specific needs and medical history. Precautions and warnings when taking omeprazole. While omeprazole is generally well tolerated, there are several precautions and warnings that individuals should be aware of when taking this medication. Pregnancy and breastfeeding. Omeprazole should be used with caution during pregnancy and while breastfeeding, as the potential risks to the developing fetus or nursing infant are not fully understood. Interactions with other medications. Omeprazole can interact with a variety of other drugs, including certain antibiotics, antifungals, and blood thinners. It is essential to inform your healthcare provider about all the medications you are currently taking. Elderly patients. Older adults may be more susceptible to the side effects of omeprazole, particularly the increased risk of bone fractures and kidney problems. Underlying medical conditions. Individuals with certain medical conditions, such as liver disease, may require close monitoring or dose adjustments when taking omeprazole. Long-term use. As discussed earlier, prolonged use of omeprazole can lead to more serious side effects, and the potential risks and benefits should be carefully weighed. It is crucial to follow the instructions provided by your healthcare provider and to report any concerning symptoms or side effects promptly. Seeking medical advice for omeprazole side effects. If you are experiencing any side effects from omeprazole, it is essential to seek medical advice from your healthcare provider. They can help you determine the underlying cause of the side effects, assess the severity, and recommend the appropriate course of action. When discussing omeprazole side effects with your doctor, be sure to provide detailed information, including the specific side effects you are experiencing, the duration and severity of the side effects, any changes in your daily routine or overall well-being, any other medications or supplements you are currently taking. Your healthcare provider may recommend adjusting the omeprazole dosage, switching to an alternative medication, or implementing lifestyle modifications to address the side effects. In some cases, they may order additional tests or refer you to a specialist for further evaluation and treatment. Remember, your health and well-being are of utmost importance, and it is crucial to work closely with your healthcare team to manage any side effects associated with omeprazole or other medications. Conclusion and final thoughts. In conclusion, while omeprazole is a widely prescribed and generally effective medication for treating various gastrointestinal conditions, it is essential to be aware of the potential side effects and their impact on daily life. By understanding the common and less common side effects, as well as the long-term implications of omeprazole use, individuals can make informed decisions about their healthcare and work closely with their healthcare providers to manage these issues. If you or someone you know is experiencing side effects from omeprazole, I encourage you to speak with your healthcare provider. Together, You can explore alternative treatment options, implement strategies to manage the side effects, and prioritize your overall well-being. Remember, your health is your most valuable asset, and taking proactive steps to address any medication-related concerns is crucial for maintaining a high quality of life.